go. All right. So welcome everybody to our first session of Skills Lab at Health Advocate X. I am the current chair of Health Advocate X, Dr. Melinda Stewart, and I am beyond words excited for this session. This is something that I stirred up in my brain a couple of months ago and was very excited when I was speaking with Donna about her ideas. And I went, this would be perfect for a skills lab. And the idea with the skills lab is that we, as advocates and caregivers, learn different skills that we can apply today. So this isn't just a community conversation where we're just talking about things. This is really an opportunity for us to learn some skills and some actionable things that we can put into practice. We do welcome you to put questions that you have in the chat, and as needed, I'll throw them in and weave them in. But I'm gonna turn this over to Donna and let her teach us a little bit about how to prepare for medical emergencies. So Donna, again, thank you so much for being our first Skills Lab instructor, and take it away. Let us know how we can help.
Thank you so much, Melinda. Welcome, everyone. I am honored to be here and I am excited to share some information with you. I have been in, and I'm not sure if I am where I am on this on the screen. I can see a lot of people, but I just wanted to share some things that I've learned with you. I'm Donna Gourlay. I have, let's see, 4 decades of experience in public health. And as part of that career, I have prepared, responded to, debriefed all of the things that we need to do for various different emergencies. They were emergencies that happened within the community. The pandemic was the most recent example. Emergencies that have happened within my family, emergencies that have happened within the organizations that I've worked. And so I want to share with that background. I want to give you some tangible things that you can do to apply to being prepared for a medical emergency. There's a lot of commonalities, a lot of common threads, themes that we have in any emergency, and preparedness is the key. If we're prepared, if we understand what our role is, things tend to go easier. Not smoothly necessarily, but they tend to go easier. When we don't know what our role is, we don't know who to reach out to, we didn't get the message, that tends to kind of erode our response, whether it's individual, corporate, or community response to an emergency. And so I want to share some information with you. We have this is going to be an interactive session today, so please get ready. Whether that's your virtual pen or your real physical pen, I have a sheet for you to take notes, so that you can remember some of the things that we discussed today. So I think Chloe's going to drop that in the chat. I'm going to share my screen because I have a few things that I want you to come along with me and see. So let me,
Donna, while you're doing that, I'll
yes,
just remind everybody that so we will be putting various documents into the chat. These documents will also be shared in a follow-up email with this recording. So if you open it and you accidentally forget it later, we will give you all of these handouts in a follow-up email with the recording. So thank you so much for creating these handouts. This is incredible. There
you
are
are welcome,
so
Melinda.
many great resources. Y'all are in for a
Yes.
treat.
And I'll just share with you, I did a lot of research. I've prepared this, presented this in other venues, and I had a hard time finding templates for us to collect information. So I've prepared these for you. I've gathered information and ideas from a lot of different sources and have put this together. There's 3 different forms in addition to the outline that I have for you to take and use. And it's a place to start. So we tend to be overwhelmed when we start to think about how do I prepare for a medical emergency? Because so many different things could go wrong with our health, the health of a loved one, the health of our spouse, as a caregiver. We don't know what to anticipate. And oftentimes, um, we want to plan for the fun things. We want to plan for an anniversary or a birthday or a vacation. But thinking about an emergency and something that is not fun, is not pleasant, oftentimes comes with a lot of emotions. We're going to dive into this today. And so I want to thank you all for taking the time out of your schedule to be here. This is not an easy conversation, but I want you to leave today feeling empowered that you have tools, you have information, and you can start to put your own plan together or help those that you work with to put a plan together so that it takes the anxiety, fear, and angst out of a medical emergency. So, what motivates you for being here? I will share with you some information as we go along. I'll share with you a little bit of my personal story. But a motivator is really, research has showed when you understand what motivates you to do something different, to step out and make change, you're much more likely to be able to implement that change. So on our outline, the very first thing on the top of the outline, it's what motivates you for being here? What motivates you to be here to talk about planning for a medical emergency and being prepared? So I want you to just take a moment, think about that. It could be you. It could be a client. It could be a family member. It could be your spouse. It could be someone who you're caring for. Who is motivating you, or maybe even what is motivating you to be here, to start to address what is it that I need to know, or what is it that I need to do to be prepared? So if you can just write that down, it could be a name, it could be a word, it could be a sentence. Whatever that is, I want you to name it because once you name it, it takes a lot of the fear out of moving forward. I want to share with you what motivated me to put this together. This is a picture of my family, and we had just bought this mountain cabin, and we were there enjoying the snow, my husband and our twin boys, who were 7 at the time, and we had a great time. It was a new adventure for our family, and less than 5 months after this picture was taken, I got that call that my husband was having a medical emergency. And I got amnesia. I'll just name it. I didn't know when I met him, the ambulance at the emergency department at the hospital. I couldn't remember that 19 years before, he had had an intracranial hemorrhage. I couldn't remember what medications he was on, let alone the doses. All I could do was just ask what happened. I just talked with him on the phone a couple of hours ago. What happened? What could happen? Why is he unresponsive? And so my motivation to being here, to sharing this information with you is because this happened to me. And it took me a while to get my feet back underneath of me. But if I had had the information, things could have gone a lot quicker, a lot more smoothly. And less than a week later, he died. He passed away. Not every medical emergency is going to end this way, fortunately. But this was my motivation to put this talk together and to share this information with you so that it would take the fear, the angst, the anxiety out of facing something that comes out of left field for you or for a family member. So today, I have a few things that I want to share with you. I want to talk about the issue. What is the problem? Why are we not prepared? I'm going to talk about a solution. And I want to talk about 3 easy steps to implementing your solution, or at least to putting your solution together. And then at the end, we're going to have some activities and then a call to action. I want you to identify what's the next thing that you're going to do. So I hope you're ready to get started. Please have your outline either pulled up or printed out that you can jot down notes, because some of this information will help you to understand why we are in the predicament that we're in, and how to respond to that, to be prepared. So the issue, excuse me, is we aren't prepared. We aren't prepared for a medical emergency or a lot of other types of emergencies because for 3 reasons I've found. One is human nature. I mentioned this earlier, we want to plan for fun things. We want to plan to celebrate. We don't want to plan for something that's unknown, that may or may not happen, that is could be catastrophic. It could be it's just too much. And we don't like to plan for negative things. In addition to that, there's a lot of emotions that are wrapped up into this. There's a lot of fear. And as I have learned, fear leads to anxiety, which leads to a whole bunch of other negative emotions. And we just don't know where to start. We're busy. We have busy lives, and I can't think about that right now. Think about that in the future. I can't tell you how many friends and colleagues have told me, I'll think about that when I'm 75. There's no guarantee you're going to live to be 75, even though you're in good health now. So delaying and putting things off just makes things harder, not only for you, but for those who are supporting you. And then health issues. I've given this presentation to a number of seniors, and oftentimes, as the older we get, our health starts to deteriorate, and we don't have the bandwidth. We don't have what we need to in order to plan for or even think about a medical emergency. We're just kind of waiting for something to happen. And I want you to leave today feeling empowered. So let's talk about some data, because I find that data or information helps me to understand the issue, and then oftentimes will motivate me to move forward and make a difference. So I've come across 2 different surveys. The interesting thing is that there's not a whole lot of data out there to say what is the real issue. And there's 2 different sources that you'll see at the bottom: the National Poll on Healthy Aging, which is through the University of Michigan and AARP, and a Harris poll. And the data is similar, but it is a little bit different. And from an aging perspective, the longer we live, the more likely we are to experience a medical emergency, because our health will deteriorate. Things don't quite work the way they used to. We might fall, whatever might happen. And we'll talk about this more in a moment on the next slide, but 3/4 of us have had at least one major emergency in our lifetime. But less than 25% of us, less than a quarter of us, have actually, experienced one in the last year. So we've had these things happen, and sometimes they've been very recent, within the last year. But most people don't have a plan for an emergency. And I found the data shows between 5% and less than 30%. Either way, it's the minority of people have developed a plan. The majority don't have a plan. And even if you have put a plan together, most people didn't communicate it. So they've put a plan together, they've thought about things, but they haven't shared that with their loved ones or who is going to help them to implement this plan. And living alone is an increased odds of not having a plan, not being prepared. And interestingly enough, in the Harris poll, they identified that most people wanted their healthcare provider to initiate the conversation, to start them thinking about what is your plan for an emergency or a medical emergency. I don't know about your healthcare providers, but mine only have less than 10 minutes with me And so there's not a whole lot of talking that I can do. However, if I've put a plan together and can start the conversation with my physician or my physician assistant or nurse practitioner or whoever is providing care for me, they will know or at least have some idea, and I can share physical documents with them to help them know what are my wishes. Author Bruce Feiler, he coined the phrase lifequake, and a lifequake is an event that happens that really causes us to pause and recalibrate our lives. And as I mentioned in the last slide, most of us have had at least one. Um, some of us have had one within the last year, but on average, the average person experiences 5 life quakes in their lifespan. 5 different events that cause them to stop and say, what do I need to do? I had a diagnosis, I had a loss, I had a death, I had something that happened that caused me to change, caused my outlook to change on things. And I want you, hopefully after today, to at least feel better prepared to experience a life quake, especially a medical emergency, which could definitely be a life quake. So, the solution, we need to make a plan before we need one. When we need a plan is not the time to make a plan. We need to have that information available and ready, and other people who will be helping us to implement or execute this know what their role is and know what the plan is. And I found the benefits of having a plan, according to the National Institute on Aging, is having a plan mitigates risks of bad outcomes. If you stop to think about it, if you're having a medical emergency, first responders are going to come and get you. They're going to take you to a hospital. Um, these people don't know you. They likely have never seen you before. Or you've been part of the system, but you haven't been in the emergency department. Emergencies are for emergencies. They're not routine, regular care. And so they won't know what your diagnoses are. They don't know what medications you are on. They won't know a lot of things about you. And so having this information and taking it with you to the hospital helps them to respond better and more efficiently and more effectively to what you're experiencing. It also reduces not only time to respond, but it also reduces anxiety and stress because we know what the plan is. We know what we're going to do to move forward. We know who that person is, that go-to person that's going to help us with this. And then having information expands options for treatment, expands options for resolution, for moving forward. And so having a plan in place before you need one is really the best idea. And I want to talk about 3 easy steps to implementing your own plan or helping those that you work with to develop their own plan. The first one is to think about a plan. So that usually involves creating just gathering information, but thinking about what is my own health status? What are my diagnoses? What are the medications that I'm taking? What are who's providing care for me? And just really doing that assessment, that personal needs assessment of am I having trouble with mobility? Do I need to make sure I have medications? Do I have a pet? What are these things that are part of who I am and what I need in order to move forward if a medical emergency happens to me? The next is to develop a plan. And we're going to talk about a couple of templates that I have to start you to collect the information that you need to understand what is this plan. And then the third thing is to communicate the plan. I have mentioned before that I've been involved for 40 years now in public health and responding to a lot of different types of things. You name it, I have responded to it, I think. And um, The first thing that fails is communication. First thing that fails and unravels things that we have put into place is communication. I didn't get the message. I wasn't part of the chain of the email or the text message. Um, I don't know what the message means. I didn't know that I was part of this. No one told me. Um, or making assumptions that are wrong. So communicating absolutely helps to everyone to be able to move forward. So, excuse me, our first activity, and we're going to move, we have three activities, but I want to take some time for you to be able to talk about, even though emergency communications is the last part of developing the plan, I want you to think about this first. I have a template which Chloe has dropped in the chat as communications, emergency communications information form. And at each form, there's the top of each form, there's your information or whoever the plan is information to fill out. You don't need to do that. Don't take your time doing that now. You can do that later. But I want you to stop and think about who are these people in your life that will help you implement this plan. It could be your spouse. It could be your cousin. It could be your best friend. It could be a fellow churchgoer. It could be someone within your senior center. It could be your best friend from college. Whoever that person is, identify who all of these people are because it will take a village for you to move through an emergency, especially a medical emergency. So, who is your village? Identify who these people are. And then I want you to narrow it down to one person. Who is that primary emergency contact person? Name them, put that on your form, and we'll talk about what to do next with that. Now, in this, you can see in the slide, I've given you 30 minutes. We don't have that much time, but I think after we end today, you can take this form and spend probably 30 minutes or less filling it out. Who are these people? How do I get in touch with them? What's their email? What's their phone number? And so I want you to just take a couple of minutes and identify who these people are, write their names down, and then who is this one primary emergency contact person. So take take that time now. We have a couple of minutes to work on this.
Donna, we just had a question in the chat that I think is really great.
Good.
Um, will there be a section for doctors to contact, or should we put them in the other section?
Excellent question. Thank you for asking. I think that was Amy. Um, Thank you for asking that question. Um, you're a woman about 3 minutes before your time, so we will be talking about that in our next activity. Yes, there absolutely is. Your healthcare providers should be part of this, and we'll talk about that. Um, I see that Robin asked, how do we explain to our clients how important this is? I think I would suggest, just like you identified your motivation, what's motivating them? What would motivate them to do this, to put a plan together? Um, I had a very dear friend of mine die just recently, and I was distressed because her response was, "I don't want to talk about it. I don't want to talk about this. I'm not ready to talk about this." And she died before she was ready to talk about it. And so the rest of us are left with, how do we implement what is her plan, and how do we implement this for her? So I think in talking with your clients, take some time to sit down with them and ask them what's important to them. Have them identify what would motivate them to want to do something like this, because oftentimes we just feel overwhelmed. I don't know where to start. I, I can't think about that. I don't have the energy to think about that. But if someone helps you with that, it's much easier to put a plan together and understand what that person's wishes are, whether that's end of life or just medical emergency. So if you don't mind, I'm trying to monitor the chat. Can you put in the chat what resonated for you with this? Was it easy to identify an emergency contact person for yourself, especially a primary contact person? I can think of several people off the top of my head, but narrowing it down to one might be a little bit challenging because I need to have a conversation with them and find out, will you be willing to play this role for me? Will you be willing to be my primary emergency contact person? I'll also give you probably a piece of advice. Having an primary emergency contact person out of your area or out of the state or even out of the country is not a good idea. Just because you lose time and efficiency with someone being so far away. I know we have wonderful tools. We have email and phones and text messaging and all kinds of chat things and social media and whatever. But having someone here present goes so much further than having someone at a distance that you're communicating with virtually or remotely. So, was this a good primary contact person? Is my husband? Absolutely. I've added your son. Thank you for sharing that, Kathleen. One of the things that was a challenge for me is after my husband died, who is my contact person, my emergency contact person that I had to write down on a variety of different forms when my children were 7 years old. I had to really think outside the box and come up with that person who is still that person today. But I had to really stop and think about that.
Yeah, Donna, I was actually going to
Yes.
ask you about that because I know when I thought about who my contact was, obviously my husband is one of them, but I also thought about who's really good in an emergency. Like my best friend, love her to death. She has known me for decades. She would know a lot of the things, but she crumbles when there's an emergency. And I think if she got a phone call that something happened to me, I don't think she'd be the best choice.
Right.
So while people are putting the little things in the chat, can you briefly talk about like what are some of the things that you would suggest in choosing that person?
Excellent, excellent question. I would suggest, like you had said, Melinda, someone who can handle things under pressure, which means also there's someone that you trust. Um, you trust that they know your plan, they know your wishes, and they will execute them for you. I also suggest, and we'll go through this in one of our next exercises, um, a financial contact person. Those could be very different people, but an immediate first primary emergency contact person, I would suggest is a couple of qualities. One is someone that you trust. And the second is someone that will be okay when they get this call, usually from out of nowhere. And are they level-headed? Can they implement and execute things for you and share information that you have given to them? Those are probably two qualities that I would suggest, in addition to someone who's fairly local to you, in close proximity to where you live. It could be a next door neighbor. If it's someone that you trust and someone who has kind of their head on their shoulders and they're it's not that they're unflappable, it's just that they're not likely to dissolve into a bunch of emotions and things can get away from them very quickly. So those are the things that I would suggest. Someone who's close by, someone you trust, and someone who you under with your experience with them, they've done okay. They've had a level head in an emergency. Great questions. MOLST, medical orders for life-sustaining treatment. Absolutely. And I am kind of going through the chat very briefly, but I appreciate everyone's comments because just having, like Melinda said, safe space to be able to talk about this and to be able to share ideas helps dissolve the anxiety, the fear, the angst, all of the negative emotions that come up with this. Now we have our next activity. And there is a medical information form that is in the chat. This is an abbreviated form. And there's also a 6-page document, which I don't want you to start that now. We'll do that you'll get that at the end. But this abbreviated form is really to start with information about your medical status. So it's gathering and collecting and understanding where can I find this information because there's a lot of things in a lot of different places, but pulling it all together is very helpful and very useful for you and for your primary emergency contact person. So some of the things that you will be looking at, is health insurance. What is your health insurance? Who are the physicians? There was a question earlier about how do you include physicians or your healthcare providers? This is a place to notate who they are. If you have, what's your preferred pharmacy? If you have your vaccine history, your medical history, surgeries, those types of things that you have had. Also, allergies. Allergies to medications, which may be, I used to take this, but I don't take this anymore because I had this reaction to it. I'll give you a perfect example. My mother-in-law, when I was her primary caregiver, she was on hospice and she was prescribed an anti-anxiety medication. I knew from experience because she lived with us for 7 years. I knew that that medication gave her anxiety. It didn't take anxiety away from her. And so, as her personal advocate, I had to tell the hospice nurse and physician, you can prescribe it, but I will not give it to her because I know how she responds, how she reacts, how her body physiologically reacts to that medication. So something as simple as I used to take this medication or I tried this medication and it doesn't work anymore. That's important information for caregivers and your medical team to know that don't prescribe this for me because this is what will happen. So we're going to take, and I put 60 minutes. So when we leave here, you can take up to 60 minutes, maybe even longer, depending on medications that you're on, diagnoses that you have. A lot of us have multiple chronic conditions or comorbidities. Um, the more of that, the longer this is going to take. But I want you to at least start to identify where can I find this information. We're going to take just a few minutes, like we did with our last exercise. And I call this a scavenger hunt because it's oftentimes where am I going to find that information? You may need to dig through a pile. You need to maybe dig through your email or dig through your files on your computer. Or if this is in a pile somewhere over here, I haven't filed it yet, but identify where this information is that you will need to find and access and pull together in order to create your medical information form. So take a couple minutes and we'll come back and we'll debrief about this exercise as well.
I'll also remind people that as you're looking through this form, if you have any questions about a certain piece, feel free to put that in the chat, and we can use this time to answer any of those questions as well.
Absolutely. Thank you, Melinda.
Judy's got a fantastic question. How realistic is it to rely on medical electronic records, such as my chart, in a time of emergency? Fantastic question.
Yes, absolutely. And thank you, Judy, for asking that question. It's a very good question to consider. And if you're having a medical emergency in your hometown and you go to your primary care or your primary physician, hospital, whatever, who has you have been there, you've built a relationship with, you have an electronic record with that, good. I have also seen within the health system that I worked is that, and this could have changed because this was a number of years ago, but the medical record in the emergency department did not match the inpatient medical record. So oftentimes when a patient arrived, it's trying to gather as much information as possible. And that could have changed. I hope that's changed by now, but I saw a big disconnect where there was, I don't have any information on this patient. I'm flying blind, so to speak. Another important thing is, what if you're not in your hometown? You don't go to your hospital, you don't have your access to your physician, caregiver team, medical team, and you're in out of state and you have a medical emergency. You're on a cruise ship and you have a medical emergency. You're on vacation in another country. They don't have access to your My Chart or anything else, any other chart. They don't have any information about you. And so this is really important information to have to be prepared so that when you go, this information goes with you. My friend, who is my primary emergency contact person and the executor of my estate and godmother to my sons, um, she wears a variety of hats, but she is the person that has this information about her parents, single spaced, has everything together, and is folded up into a piece of paper and is in her wallet. So that when she takes her parents to their not hospital, but doctor's visits or gets their vaccine or whatever, she has that information and updates that information, and she's uber prepared. Now you know why she's on my team, because of who she is, but her personality, but she's also a person that I trust.
Cheryl mentions that she has her in documents in a page protector that stays in her suitcase. And the point that you raised about taking these things with you, that
Yes,
is such an important thing because if this is at home, like I know somebody who's like, "Oh, put it in your freezer." Like, who the heck is going to look in the freezer to find this documentation? And secondly, you know, I just did a cruise and honestly, I didn't have any of this information with me. Should have. But yeah, take this stuff with you and have it in your
absolutely.
suitcase. Have it with you. Have it
You can do
folded
a
up in your
couple of
car.
things. Yes, so thank you, Melinda, and everyone else who's talked about this. I have suggested to seniors that you have your medical information, this form, or whatever you want to have included in that form. Um, Print that out, put it in a page protector, and put it on your refrigerator. Especially if you're living alone, emergency responders are going to come into your home. They're not going to know anything. They've never been to your place. But if they see something like this posted on your refrigerator, that is something that they or your emergency contact person should say, and here this is, and we're going to take this with us to the hospital. Now, I'm going to talk about privacy and protecting personal information and that in just a minute, but you can also put it on a little flash drive. You can put it on your phone. You can do a number of things with it, but redundancy is important. Redundancy is important. So I'm the type of person that I have plan A and plan B, and probably plan C is boiling on the back burner because I want to be prepared. Um, and so having multiple copies of things, having people having copies of things, having it in my device or in a flash drive that I carry with me, whatever works for you, just to make sure that you do it, that you have it. So,
Comment
yes.
as you're prepping for the next activity. I love Maggie's comment. First responders are trained to check the back of the front door and in the refrigerator. So, okay, cool. Or on the refrigerator. And if I love this piece of advice, if you have more than one person living in the home, add a headshot photo in the corner of that printout.
Excellent idea.
That's a cool idea. Thanks,
Yes.
Maggie.
Who is this? Because first responders won't know who you are.
Right.
You usually don't have a wristband unless, I don't know, maybe that has your personal identification on it, and this is who I am. So I love that. Love that idea. Thank you, Maggie. So with this, how did this go? Is it easy to identify where I can find the information that I need in order to pull together? Sometimes I think, ooh, I don't know where I can find that information. I'm going to have to sit and either go into my chart or whatever that electronic medical record or electronic health record is. I may not know what this information is, and I may have to do some investigation. But was this an easy exercise, or was it a challenge? A challenge to identify where you can find these things. It's probably a challenge if you're trying to help someone else put this together for them, right? Because you don't know. Even if you're living in the same house, you may not know where this information is. So thank you for your comments. And our last activity is also a part of a scavenger hunt. And this is legal and financial information. Um, Again, there's a template for you to fill out, but I also have a checklist as part of this template that has a variety of information on estate and finances, your health care, and then I've listed out on the second page, probably at least half of the page is a checklist of important information on documents you may need, like military records, especially if you're part of the VA system. A birth certificate. If you were adopted, do you have that information? You have your adoptive papers. Do you have, what do you have? What do you need? So I've given you a checklist to try to at least trigger some thoughts about, do I need this information or do I have it? If you don't need it, you can just check no. Or if I do need it and I don't have it, maybe I highlight that specific thing. Um, One of the things that was when my husband passed away, I was really surprised at number one, how many people needed a copy of a death certificate. It was phenomenal how many people needed a copy of a death certificate and how many people or organizations needed a copy of our marriage certificate. I never would have thought of that one. But so there's a number of documents that you may need to gather, you may need to have, or if you were divorced, um, what's the paperwork that says you were divorced? And I'll tell you, just give you a quick example. A friend of mine um, had a uh, partner. They were never married, and he died very unexpectedly. And 7 years later, a person emerged from nowhere and said, I was married to him, and I just found out that our divorce was never recorded, was never finalized. I can't make this stuff up. So make sure that you have the documents that you need, or that the person that you're working with, patient or client, has what they need, so that you're not scrambling and you're not trying to find things that you really need and that aren't there. So take a few minutes. I put again 30 minutes for legal and health information, financial information that might take you longer to do this, but spend some time and really maybe just highlight some of the things. I know I'm going to need to get this. And we'll come back in just a few moments. And if you do have questions, please type them in the chat or even comments.
Donna, something that just came up in my brain is I feel like a lot of times adults think these things and we plan these things because our brains after a certain age do start to go, okay, what might happen? But I want to encourage young people, like, and if you're working with young people, like 20-year-olds are not going to be thinking about these things, but it's important that, my brother passed away very quickly. And
Sorry.
we had no idea. Um, but he was 24.
Mm,
And my dad had to scramble and get all of these things and figure so much of this
yes.
out because he was an adult, he was on his own. So, you know, thinking these things through and having these conversations. And as you mentioned before, we don't like having these conversations.
No, it's
Nobody wants
uncomfortable.
to have these conversations, but
It's
they're
like if
so
it's like
important.
if we bring it up, if we talk about it, we're going to be jinxed and
Yeah,
something bad's going to happen.
no,
No.
no.
But
Think things going
very
forward.
good point, especially if you're caring for an adult child who has um, disabilities or diagnoses or things that you need to be their caregiver. It's absolutely important to think through that with them if they're able to do that, so that you know what their wishes are and that you know in the event of a medical emergency, what do they want. I've had I've just had a conversation with my sister within the last week, and she is much older than I am, but we talked about our mother and who she was diagnosed with cancer and said, I'm not doing radiation chemotherapy. And she was almost bullied into, or tried to be bullied by her physicians and her oncologists. You have to do this. And she said, I don't want to do this. And my sister said, if I'm diagnosed with something like that, I don't want to go through that. I don't want, nope, I'm going to refuse that. And some of us are health advocates, and that's our part of our job, part of our mission, part of who we are, is to make sure that we preserve people's wishes. It may go against medical advice, but every one of us should have the agency and autonomy to say, I do or don't want this. I do want life support. I do want to be kept alive. I don't want to be kept alive. It's our decision. But if we don't communicate what our decision is or what our wishes are, things can happen that we might not want to happen. So it's important to plan. Um, thank you so much. And then was this one harder? Was this one harder than the previous two? Financial and other types of information is legal information oftentimes is confusing. I don't know where to start. I don't know who can help me with this. And so I want to ask the question, is your primary emergency contact person the same as your contact person for legal and financial information? And if it's not, that's okay. And if it is, that's okay. But have you thought about it? And then the next thing we're going to talk about is how to communicate this information. So I want to give you just a brief resource that the federal government surprisingly has available for us, and that is on ready.gov. You can see on the toolbar at the top, it says make a plan. You can click on that, and there's information to fill out, questions, prompts, whatever that you will be asked, or fields to fill out. And you can make this plan. It's limited. There's some information, it's good information, not a whole lot of detailed information, but it's essentially for any type of an emergency. It could be a medical emergency, it could be a disaster, natural, man-made disaster. But this is a place to start. And the neat thing about this is that you can complete it and you can send it to relatives, multiple people, to your emergency contact people, your primary contact person, or your spouse, or whoever that you want to send that to. And you can also download a copy. So I encourage you to check out this resource from the federal government at ready.gov to create a template, use a template to create a plan. Now, so we put together a lot of information, right? Or at least we've thought about it. And how do we put this together and what do we complete? How do we bring this all together? I want to just take a moment and have us think about protecting either paper documents or electronic documents. On my computer, people cannot get into you can't start up my computer and jump into it because it's password protected. So to open up my computer, the first thing is a password. How do you get into my computer? The people that need to know what my password is. I have not saved my passwords on the back of my keyboard. I don't recommend that because that's not secure or safe. But if your primary contact people know what that is, and where those documents are, or they have a copy, I would also, and I mentioned this before, having redundancy, having paper versions and electronic versions of this information, and sharing that with your primary contact and your village. You don't need to share certain medical information, but you can share certain things like these are my wishes, these are my instructions, this is what I want to have happen. And then make sure that as you revise these, because these should be revised, you should look at them, I would say, at least every year or two and see if anything has changed. If your primary contact person is no longer here, whether they're no longer in the area or they have passed away, who's your new primary contact person? Um, and update that, keep that information updated, and make sure that the people who need this information have it. The last thing I want to do is a call to action. So, no good presentation is really going to leave you hanging on the edge. I want you to figure out what's the next thing that you want to do. And I've listed four different things. There could be others, but just as an example, what's your next step that you're going to take? Is it you're going to set a date and call your primary contact person and say, hey, would you be willing to do this for me? The next thing maybe is to schedule time with family and share your wishes, share information. Um, Hint, don't do this at a holiday, important family gatherings. That's not the time to do this. It's not the time to overwhelm because there's already so many things built on top of Christmas and Thanksgiving and Easter and Hanukkah and any other celebration that we have with our family. Schedule some time, maybe cook dinner for them and have them come over, just because, and then share your plans with them. Maybe it's you're going to schedule or identify 1 hour and put it in your schedule because we're all busy, right? 1 hour that you're going to continue to work on these documents, on your templates, and complete the information. Or maybe it's you're going to create a binder, whether it's a physical binder or an electronic binder, maybe even both, that you have put all of this information together in one place and share that with the people that you need. And I really recommend having it either cloud storage or a flash drive storage because how many of us have had a computer die or fail or seize or do something unusual and we've either lost things or we have a really hard time getting them back. Make sure you have an external copy of this, not saved on your computer, but saved to the cloud, Google Docs, OneDrive, whatever your method of choice is, um, and a flash drive. So, your next step, write that down on the last page of your outline. What's the next thing that you're going to do? Identify that. And I'll share with you the thing that I'm going to do. And I've talked with a couple of people about this, is my next step is I'm scheduling an appointment next month with my estate attorney, and I'm reviewing and revising my legal documents because it's been a while. It's been a few years since I've done that, and it's time to do that again. And so I need to make sure, um, now that my children are adults, I don't need to name a caregiver or a person for them, a guardian for them. Um, so I need to make sure that everything is still as I want it to be. What's your next step?
We are just at time, so I just want to say thank you so much, Donna. This was incredible and really gave some really, really useful tips and ideas to get people started. And I want to thank everybody for your participation and your comments in the chat. I want to let you know as this is the first of 4 skills labs that we will be doing. And I'll just highlight that the next one will be happening in May. And it's going to be the follow-up from our community conversation in January about not paying that first bill and understanding EOBs and just really understanding some of the billing sides of the healthcare system. So we've got Andrew coming back to give us some real tips and things things that we can do that day. If you have ideas or skills that you would like to learn, please, 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 please email us at info@healthadvocatex.org. We would love, because if I get lots more ideas of people wanting more skills lab, I will make more of these happen. We plan to do 4 this year, but I'm happy to do 1 a month if we need to, if it's going to give you the skills that you need. So again, thank you so much. All of these amazing handouts and a couple other ones will be emailed to you. Donna, any last quick tips that you want to give people to leave them with?
I just put in the chat, but I want to thank you all for being here, taking time out of your busy schedule. We have so many other things clamoring for our attention. And I think this is an important thing that we need to talk about, that we need to think about. I also I have compiled a list of
Ooh.
games that you can purchase. They're mostly card games that you can purchase. You don't have to purchase all of them to start the conversation with your family or your loved ones,
Mhm.
because that takes the burden off of, how do I start this conversation, this hard conversation?
Mhm.
So if you're interested in that, Chloe will have that and she can send that to you if you're interested in, hey, how do I start this conversation? But there's a number of things that you can do to move forward. And I hope today that you feel empowered to take those next steps. Thank you so much.
Thank you all. And I will just say, if you need a physical person to help you with these conversations, my organization, Compassionate Navigation, that's exactly what we do. We help families and individuals have difficult conversations, and many of them do include this kind of planning. So feel free to reach out and let us know if we can be of any help. But have a wonderful afternoon. Thank you all so much.
Thank you.